Hi, I'm Dr. Hazet, and today we're going to be talking about 9 symptoms that are related to depression. The National Institute of Mental Health estimates that 60 million adults in the United States have at least one major depressive episode in their lifetime. But what is depression? In general, we all have different feelings of sadness or grief from time to time. However, they usually go away within a few days. Just because you experience some level of sadness does not mean that you are clinically depressed or have a mood disorder. What is important to keep in mind when we experience a mood disorder, these symptoms are long-lasting and can be overwhelming with sadness, loss of appetite, lack of interest, overall low energy. If left untreated, depression can result in serious health complication and even death. Now, before we're going to talk about the 9 major symptoms of depression, I would like you to keep in mind that this video is not designed to diagnose you. It is simply an invitation for you to reach out for help should you find out that these symptoms are applicable to you. One common questionnaire that most clinicians use is called the PHQ-9, or the Patient Health Questionnaire, which I will include this questionnaire at the bottom of this video should you choose to self-assess. A lot of time when thinking about depression, it is important to think about a continuum of emotion. Just because one experiences sadness does not mean that they are clinically depressed. One thing to keep in mind when trying to understand depression is that whether over the course of several weeks you have experienced a high intensity of these symptoms. So with that in mind, the first symptom of depression is lack of pleasure in doing things. When we are depressed, there is little interest in taking part in activities we once used to enjoy. We tend to withdraw from these activities and don't experience the same level of joy that we once used to have. The second symptom of depression is a general feeling of sadness or hopelessness or depression. The best way to describe it is like viewing the world through some form of emotional dreariness, constant feeling of doom or down. The third symptom of depression is associated with sleep difficulty. Too much or too little sleep can suggest that you are off balance and maybe having trouble falling asleep due to constant negative thinking or vice versa. Sleeping too much, such as a way to escape from the current emotional pain. The fourth symptom is constant lack of energy, feeling lethargic, heaviness, and lack of energy to engage in tasks that are simple as taking care of your personal hygiene in the morning, or completing tasks at work or school. Everything feels like a burden or overwhelming. The fifth symptom is related to appetite. Some people, when they are depressed, they engage in emotional eating and therefore eat excessively. On the extreme opposite, some people, when feeling depressed, they may skip a meal or forget to eat altogether or experience lack of appetite. The sixth symptoms of depression is related to general feeling about yourself, negative feelings about yourself, specifically negative emotions that keep coming up for you about yourself or the way in which your family may perceive you. So thoughts like, I'm a failure, I let my family down, I'm not good enough, are all examples of negative thoughts. The seventh symptom is related to overall concentration level. Simple tasks such as reading or paying attention to a favorite show can become overwhelming. You may find your mind wandering over and over again. The eighth symptom is related to your level of movement. Some people, when they're feeling very depressed, they become extremely restless. That's fidgeting, moving around constantly, as if they have ants in their pants. However, some individuals feel very slow, lethargic. Movements are so challenging that they may speak or move slower than usual. The ninth symptom is related to thoughts of suicide. If you are experiencing such thoughts, please know that this is your mind telling you to engage in self-alienation, which is a symptom of depression. If this is something that you were experiencing, I would urge you to seek out help. I included some links below for places where you could reach out and talk about these thoughts and get some help. I know a lot of time people have difficulty talking about thoughts of ending their lives. At the same time, depression could be a temporary situation. If you reach out for help, you might be able to resolve it. If you know somebody who struggles with depression and recognizes these symptoms, please share this video with them. I hope you heard something that was helpful for you today. If you like what you heard, and if you find this information helpful, please comment below, like, share this video, and subscribe to my channel as a way to assist me with reaching out to more people. Be well.